As we get ready to start talking about diagnosing a specific disorder, I want to walk you through a little bit of a process here. When we looked at anxiety disorders, we know that there's DSM criteria and you have to look at the criteria. A mood disorder really is not any different, but the thing that is different is that you have to look at two different sets of criteria. I'm going to ask you this question on the quiz, and so I want to be sure that you're able to distinguish the difference between diagnosing an episode and diagnosing a disorder. So let's say that I am working with you and I have kind of a good feeling that you're probably dealing with major depressive disorder. So I'm going to go to the DSM criteria for major depressive disorder. Well, the first criteria states you've had the presence of a major depressive episode. So before you can go any further, you're going to have to go to the criteria for an episode and see if I meet that criteria. If I don't meet the criteria for an episode, I'm not going to be looking at major depressive disorder. So let's back up and let's look at the criteria for an episode. Well, the criteria says that I have to have 5 or more of the symptoms that are listed for at least a period of 2 weeks. I'm going to have to look over here because I don't have this stuff memorized. So I'm looking at the criteria just like you guys are. So that's A, 5 or more of those criteria. So I look at these 9 things here and say, are 5 of those present? Well, if yes, 5 of those things are present, then I'm going to go to B. B says I don't meet the criteria for a mixed episode. Okay, so that means I've not had any of the symptoms of a mixed episode. Depression only, no presence of any mania or hypomania. So then, no, I don't meet the criteria for a mixed episode. So now I'm going to look at C. And C says, has it caused significant impairment? So we're going to look at what's going on in my life and are my symptoms impairing me in such a way that there's areas of my life in which I'm not able to function normally. Now, that doesn't mean I have to not be able to function at all. It can mean that there's a decline in that function. Maybe I can go to work on some days, but there are days that my symptoms are so severe that I can't go to work. Or maybe I'm isolating myself socially and not going out and doing things like I used to do with my friends, but I'm still taking care of obligations. I'm still going to church, or I'm still going to work. I'm going to things that I really can't get out of. So is impairment in place? Well, yes, if there is some level of impairment, then we look at D. D says that this is not the direct effect of a substance, any type of, and it could be illegal substance, or it can be alcohol, it could be prescribed medication, or it's not a part of a medical condition. I don't have any medical condition that's going on that might be creating these symptoms. It's very important that you address that you say these things have been ruled out. If they haven't been ruled out, then you need to consider that before you make a diagnosis. If you have concerns that maybe there's some medical issues going on that might be contributing to it, then the proper thing to do would be that you would refer the individual to a physician to rule that out. Now, I'm going to tell you in some of the case, in fact, in most of the case studies that we're going to read, we're not going to be able to know whether or not the person has been to a doctor to rule out medical stuff. So we're just going to assume, unless other information is presented, we're going to assume that we can rule that out. This isn't real life. We can't actually go through and walk through the process that we would go through. So in real life, we would rule that out. But with the case studies, we may not be able to. Okay, so then the next symptoms for a depressive episode is that this is not better accounted for by bereavement. Okay, there's a difference between bereavement and grief. Grief is a process that takes, some say as long as 2 years to overcome. Bereavement is going to be that 2-month period right after a loss in which we would expect that individuals would be experiencing some level of impairment or some of these symptoms. If I just had a significant loss, then yes, I may exhibit 5 of the depression symptoms. So if we're going to say that this is not accounted for by bereavement, then we have to say the person is beyond that 2-month period. If they're within that 2-month period after the loss, then we would not consider major depressive disorder. Now, some of those symptoms could exceed that period, and what we know is that most people within 2 months are going to move beyond that. But then if we have some people who have unresolved grief issues, that type of thing, they may not move beyond those symptoms. So if I've met all of these criteria, then we're saying that's for a major depressive episode. So now we jump back to the criteria for major depression. So if I meet the criteria for an episode, now we're looking at the criteria for major depression. A, presence of a major depressive episode. Yes, I've done that. B, the major depressive episode is not better accounted for by schizoaffective disorder. It's not a part of schizophrenia, schizophreniform disorder, delusional disorder, or a psychotic disorder. So we have to address that as well. If we have concerns that any of those disorders are present, then I'm not meeting that criteria, which means I can't be diagnosed with major depression. So let's say we've ruled all that out. So now we go to C. There's never been a manic episode, a mixed episode, or a hypomanic episode. So if I've had anything that appears to be any of those, then we have to consider something else, which would be bipolar or cyclothymic. Okay, so we would have to rule out major depression. So be sure that you've looked at the criteria, you've gone through each of the steps, each of the bullets, and when you talk about cases, I want you to do that in your papers. I want you to go through the criteria step by step. Do not leave anything out. If you can say, no, I don't think that there are any other disorders here, don't just leave that out. Make that statement. Okay, these disorders have been ruled out. Symptoms are not better accounted for by these disorders. So I wanted to walk you through that process because you're going to be asked some of those questions in the Carlos and Gina quiz, and I want to make sure that you're prepared to answer those correctly. Have fun with the quiz.